So it's been a while since you've seen me with glasses on. I usually have glasses. This is what I look like. I think my prescription is -3, -2.5, or -3.5, -3. I've decided to get LASIK, or LASIK, LASIK surgery today, and I'm pretty excited because that means I'll be able to see when I wake up.
So, how are you?
Hi, I'm good.
So, I need your information now.
Okay.
The consultant will take you through the forms you'll have to fill out. It's pretty simple stuff like your name, age, height, weight, and simple medical history. Before we continue, thanks to Tony from Seoul Guide Medical for helping me sort out everything from my consultation to the surgery. If you're interested in this surgery or any other procedures, Seoul Guide Medical's contact information is in the description box below.
The doctor is going to check the health of my eyes. 그, 4, 3? 몰라요. Airplane? 비행기? After the procedure, I will be able to see to the line that he pointed at just now. When he pointed at the airplane, I thought it was supposed to be Hangul, like the Korean letters, so I was just like, no idea. So for this test, he's going to be testing exactly how bad my eyes are in terms of the degrees, so minus whatever or plus whatever. So what I'm seeing right now, it's like a green field with like a road leading to like a red barn with fences along the road, white fences. I remember back in Canada when I did this test, it was a hot air balloon. So what is it in your country? So now he's gonna do it again, but this time he's checking my pupil size. This machine is gonna shoot like air into my eye, I guess to test my eyeball resistance or eyeball pressure.
Okay. Okay.
This machine is gonna test my cornea thickness.
평균 각막 두께가 500에서 530인데
네.
570, 570
나쁜 거예요?
좋은 거예요.
아, 좋은 거예요? So there's usually two ways to do this test. The one that I guess most people are used to is this giant machine that swings out, and then you do your testing if you're nearsighted or how bad your nearsightedness or farsightedness is. Oh, okay, so we're gonna test how my sight is now based on the glasses that I have right now. RD, VFC, FTV, NZF.
이제 안경 안 쓰고 해볼게요.
9?
오,
안 보여요.
이건 안 보여요?
안 보여. No, it's just a bunch of blurs now. I guess my eyes are really bad. We're going old school, old school. 삼, 팔, 셋, 육, 구. Most of you will probably be doing the more modern version where everything's done with a machine. So this machine is going to be testing or examining my retina health. It's going to take a picture of it.
Right.
Yeah, this is my right retina. All those other pictures were what could go wrong or was like unhealthy eyes, and mine are perfectly fine. This machine is also for cornea thickness, and there will be one more machine for cornea thickness because that's how important your cornea is for all these surgeries. So we're doing 3 cornea tests. This test kind of showed whether or not I have astigmatism. So I found out that yes, I do have astigmatism, but it's not terribly bad, thank goodness. So here, basically it's darker, so higher up on the scale means it's, I guess, higher up or thicker. On a healthy eye with no astigmatism, the shapes are supposed to just be circles, radiating from the center, but mine is weird. So this machine is supposed to test whether or not I have glaucoma, which is supposed to be a really bad disease, I guess, but apparently I'm too young for it. The top picture is the side view, and it's supposed to dip down in the middle. And the bottom picture is just a bird's eye view. That's normal. So the dip in the middle is normal. What's not normal is if there's like a bump, because that means there's some sort of buildup. So now I'm gonna do a tear test, I guess, and he's just gonna stick pieces of paper in my eyes.
왼쪽이 8mm 정도, 오른쪽이 한 4mm 정도.
I need to drink more water. A handsome doctor just explained to me that my cornea thickness is 574 micrometers on my left eye and 577 on my right eye. Now, at this clinic, they have to leave 400 micrometers minimum. So I have 174 micrometers and 177 micrometers that I can work with.
After the tests, the consultant will go over the possible surgeries you can choose from. In this case and for this video, I chose to have LASIK done to my left eye. She'll then go through the basics of how the procedure is done. You'll then sign consent forms acknowledging your understanding of the risks and potential side effects of the procedure before you head off to see your surgeon. Your surgeon will do another basic eye health check and explain your procedure one last time. You'll then put on your sterilized gown and the rest is surgery. If you came with family or friends, they can watch through a giant glass window, so for them, gowns aren't required. Detailed surgery footage is coming next, so if you're uncomfortable with that, please skip to 7 minutes and 20 seconds for information on how to contact Tony from Seoul Guide Medical if you want to book a procedure. The surgeon will use a set of clamps to keep your eyelids from closing. Your eyes will be constantly hydrated. The surgeon will start the procedure by using a mechanical surgical tool called a microkeratome to create a thin circular flap on your cornea. During this part of the procedure, you will feel a lot of pressure on your eye, but that's the machine making sure your eye doesn't move. The cutting of the flap is done automatically by the machine. Once the surgery is complete, your vision will have actually been immediately corrected. You'll be led to an eye test chart to test out your brand new corrective vision, and you'll be amazed by how much it has improved.
74 36 42 76 37 42
You'll then rest at the clinic for about 30 minutes before you can go home. If you're interested in plastic surgery, vision correction, skin treatments, dental, or other medical procedures, contact our good friend Tony Medina at Seoul Guide Medical via their Facebook page or by emailing them at seoulguidemedical@gmail.com. And if you know someone with bad vision or who's looking to get corrective eye surgery, please like and share this video with them.